Last night while you were sleeping, something was happening inside your body that you had absolutely no awareness of. Not a disease, not a medication side effect, not anything you ate, something much simpler and much more overlooked than any of those things. The position your body was in while you slept was either helping your brain recover properly or quietly working against it. And the difference between those two outcomes is not small. It affects how much oxygen reached your brain overnight. It affects whether the blood flow to critical brain structures was restricted for hours. It affects how well your brain cleared out the waste products that accumulate during waking hours, and that research increasingly links to long-term cognitive decline. I am Wesley Harper, and today we are talking about 6 sleeping mistakes that are quietly damaging the brain and heart health of millions of older adults every single night. And then I am going to give you the 2 sleeping positions that the research actually supports for adults over 60 who want to give their brain and cardiovascular system the best possible recovery every night. Your doctor has almost certainly never brought any of this up in a checkup. There is simply not time. But this information is worth understanding because, unlike most health interventions, this one costs nothing, requires no prescription, and you can start tonight. Before we go any further, drop a comment right now and tell me one thing. Are you a back sleeper, a side sleeper, or a stomach sleeper? I am going to be referring to all 3 throughout this video, and your answer is going to become very relevant very quickly. Now, before we get into the 6 mistakes, I want to give you the context that makes everything else make sense. Because without this foundation, the mistakes on this list are going to sound less serious than they actually are. When you are young, your blood vessels are elastic and flexible. They stretch and adapt. If you sleep in an awkward position, your cardiovascular system quietly compensates, and you wake up with a stiff neck that is the extent of it. After 60, that compensation ability is meaningfully reduced. Your arterial walls have naturally stiffened over time. The small vessels feeding your brain are less flexible than they were at 40. Your blood pressure regulation system, which normally keeps circulation balanced throughout the night, operates more slowly and less precisely. There is something called overnight blood pressure dipping that healthy sleepers experience. During sleep, blood pressure naturally drops by about 10 to 20%. This drop is protective. It gives your heart and blood vessels genuine recovery time. It is one of the most important cardiovascular events of your entire day, and it happens while you are unconscious. But certain sleep positions disrupt this protective dip. They restrict the wrong vessels, compress the wrong structures, or alter blood flow in ways that prevent this recovery from happening properly. And when that recovery does not happen, the heart and brain enter the next day without the restoration they needed. Research has shown that stroke risk peaks in the morning hours after waking. This is not coincidence. What happens during the hours before that morning surge, how you are positioned, whether your body is properly recovering, directly influences how vulnerable your cardiovascular system is when the morning blood pressure increase hits. The sleep you thought was protecting you may actually be setting you up for the most dangerous hours of your day. With that in mind, let us go through the 6 mistakes. The first mistake is one that most people would never think of as a mistake at all. Sleeping completely flat with no head elevation, no pillow, or just a very thin one. Body perfectly horizontal. It actually sounds healthy. Mattress companies market this position. Physiotherapy websites recommend it for spinal alignment. But there is a critical piece of the picture that almost no one talks about for older adults specifically. When you lie completely flat, the fluid dynamics inside your skull change. Cerebrospinal fluid, which cushions and protects your brain, can shift in ways that incrementally increase pressure inside the skull. The tiny blood vessels inside your brain that have already experienced decades of normal wear are now under slightly more pressure than they should be for 7 or 8 hours straight every single night. A study published in the Journal of Clinical Sleep Medicine found that even a modest head elevation of around 15 degrees led to measurable improvements in intracranial pressure and blood flow dynamics during sleep. This is not a dramatic finding, it is a subtle one, but subtle, sustained nightly effects add up significantly over months and years. The symptom that most people completely misread is waking at 2 or 3 in the morning with a dull, throbbing headache, behind the eyes, at the base of the skull. Most older adults who experience this assume it is just one of those things and take a pain reliever and go back to sleep. But that headache may actually be your brain's signal that the pressure inside has been elevated for too long. Your body trying to get your attention about something happening during hours when you are not awake to notice. The fix is simple: a 15-degree elevation of your upper body, not just a pillow under your head, your entire upper torso on a gentle incline. I will explain the safest way to achieve this later in this video. The second mistake is one that many people are firmly attached to and will be surprised to hear carries genuine risk. Stomach sleeping. When you sleep face down, you cannot breathe into a mattress, so you rotate your head to one side, usually the same side every night because most of us are habitual sleepers. That means your neck is rotated up to 90 degrees for 7 to 8 hours every single night. Running along the sides of your cervical spine are two arteries called the vertebral arteries. These vessels carry blood directly to your brainstem, your cerebellum, and the areas of your brain responsible for balance, breathing regulation, and coordination. When your neck is held in a significantly rotated position for hours, these arteries can become partially kinked. Think of stepping on a garden hose. The flow does not stop completely, but it becomes restricted. And restricted blood flow to the brainstem for 8 hours, night after night over years, is not something your body simply absorbs without consequence. Research published in a Journal of Manipulative and Physiological Therapeutics confirmed that significant cervical rotation measurably reduces vertebral artery blood flow velocity. The study was conducted in the context of physical manipulation, but the anatomical principle applies directly and completely to sustained sleep position. There is a second problem with stomach sleeping that affects breathing directly. Your rib cage is pressed against the mattress all night. Every breath you take is working against that compression. Your diaphragm cannot descend fully. You never achieve the deepest, most restorative breath your lungs are capable of. Less oxygen with every breath for an entire night. Combined with restricted vertebral artery flow, these two effects happen simultaneously for hours in a body that is already less able to compensate for them than it was 20 years ago. For a healthy 35-year-old, the body manages around these pressures. For an older adult with any cardiovascular history or hypertension, this is a cumulative nightly problem that builds invisibly over time. The third mistake is one that people make with genuinely good intentions: stacking multiple pillows under your head. 2, 3, sometimes 4 pillows. People do this for real and valid reasons: acid reflux, sinus drainage, snoring, breathing difficulties during sleep. A small amount of elevation genuinely helps with some of these issues, but when head elevation becomes excessive through pillow stacking, a specific and serious problem develops in the neck. When your head is elevated too high, your chin tilts toward your chest. This forward bending of the neck, called cervical flexion, compresses the vertebral arteries from the front rather than the side. Same arteries, same restricted flow, different mechanism. But there is a third vessel involved here that almost never gets mentioned in these conversations: the internal jugular vein. This is your brain's primary drainage pathway. It carries deoxygenated blood back down from the brain toward the heart. When the neck is bent forward excessively, this drainage pathway becomes partially obstructed. Blood drains from the brain less efficiently. Pressure inside the skull builds slowly across the night, and the brain's ability to clear metabolic waste products during sleep becomes compromised. You may recognize the morning result of this without ever having connected it to your pillow stack: brain fog when you wake up, a heaviness behind the eyes, the deeply frustrating experience of waking from 8 hours of sleep and still feeling completely unrefreshed. Your brain may have been literally working against restricted drainage all night. The correction is one pillow, one properly shaped pillow that supports the natural curve of your neck without forcing your head into an angle. A contoured memory foam cervical pillow is ideal because it cradles the neck rather than pushing the head forward. Many people who make this single change report that their morning headaches disappear within a week. 1 pillow. Drop a comment below right now and tell me how many pillows you currently use at night. I am genuinely curious, and I think the number of people in this community using 3 or 4 is going to surprise a lot of people reading those comments. The fourth mistake is one that is going to genuinely surprise a large number of people watching this because side sleeping is generally considered a healthy position. The direction you face changes the equation significantly. Right side sleeping with any cardiovascular history. Your heart sits slightly left of center in your chest. It has a natural orientation and resting position. When you lie on your right side, gravity pulls your heart subtly away from its optimal resting alignment. More importantly, the weight of your body compresses the right side of your torso, where a major blood vessel called the inferior vena cava runs. This vessel has one critical job. It returns blood from everything below your waist, your legs, your abdomen, your digestive organs, back up to the heart. When you compress that vein by lying on your right side, the return of blood to the heart is partially restricted. Your heart has to work harder to pull blood into each chamber because less is arriving on its own. For a healthy person, this is compensated for without difficulty. But for an older adult managing borderline heart function, mild heart failure, or chronic high blood pressure, your heart is already working near its practical ceiling. Adding unnecessary nightly resistance is like running an engine slightly harder than needed every single night for years. The cumulative wear on a heart that cannot afford it is real and measurable. Research published in the European Journal of Heart Failure found that patients with heart failure naturally and instinctively gravitated away from right-side sleeping. Their bodies were detecting the cardiovascular burden before their conscious minds identified why. That instinct carries important information. If you are a right-side sleeper with any history of heart disease, high blood pressure, or heart failure, this is the most directly actionable change on this entire list for you. The fifth mistake is one that millions of older adults, particularly women, never think twice about because it has been their natural, comfortable sleeping position for their entire adult lives. The tightly curled fetal position, knees pulled up toward the chest, shoulders rounded forward, chin tucked, the body wrapping around itself. It feels warm and safe. But physiologically, 3 things go wrong at the same time. First, your lungs are compressed. The rib cage cannot expand fully. Every breath across the entire night is shallower than your respiratory system is capable of. Blood oxygen saturation drops incrementally with each restricted breath. Multiply a modest reduction in oxygen per breath across every breath in 8 hours of sleep, and the cumulative effect on brain tissue that is already aging is meaningful. Second, the blood vessels running through your hip joints and behind your knees are bent and partially compressed. Circulation to and from the lower limbs is reduced. If you already have a tendency toward swollen ankles, poor leg circulation, or any history of blood clots in the legs, the fetal position makes all of these worse overnight. Third, your neck is flexed forward. Everything we discussed about what forward neck flexion does to vertebral artery flow and jugular drainage applies fully here. The fetal position creates a whole body version of the compression pattern that individual mistakes create in isolation. Research documented that sustained spinal flexion during sleep measurably reduces tidal volume, the amount of air taken in with each breath. The implications for an older adult who already has less respiratory reserve than a younger person are significant. If the fetal position is where you naturally fall asleep, the adjustment does not have to be dramatic. A body pillow in front of you gives your arms something to hold, so the comfort and security of the position is preserved. A pillow between your knees takes the hip compression out of the equation. A slight opening of the angle between your torso and your thighs, just a few degrees, reduces the lung compression while still allowing you to sleep on your side in a position that feels familiar. Small changes with real results. The sixth mistake is the most socially common one on this entire list, and it is one that most people do not even think of as a sleep mistake at all because it happens before they get into bed. Eating a large meal or drinking alcohol close to bedtime, dinner at 7:30, a glass of wine while watching television, in bed by 10. For millions of older adults, this is simply a normal evening. But here is what is happening inside your body during the hours of sleep that follow. After a significant meal, your body redirects a meaningful volume of blood toward the digestive system to process what you ate. In a younger body with flexible, responsive blood vessels, this redistribution is managed seamlessly. In an older body with stiffer arteries and a slower autonomic nervous system, this shift away from the brain and heart toward the gut can create transient reductions in cerebral blood flow. Brief periods where the brain is subtly undersupplied while the gut takes priority. Alcohol compounds this significantly. Alcohol is a vasodilator. It relaxes and widens blood vessels, which causes blood pressure to drop. Your body senses this drop and compensates by constricting vessels and raising pressure to correct it. The result is that blood pressure oscillates up and down throughout the night, rather than following the natural protective downward dip that healthy sleep produces. Research published in the American Journal of Hypertension found that even moderate alcohol consumption within 3 hours of sleep disrupted the natural nighttime blood pressure dip that is so important for cardiovascular recovery. You may have experienced the result of this without knowing what caused it. Waking at 2 a.m. with your heart beating noticeably, a feeling of warmth, slight sweating. You assumed it was a vivid dream or just something that happens. But what you experienced was your vascular system working to stabilize itself through a pattern of pressure fluctuations it was not well equipped to manage. The practical changes here are straightforward. Finish eating at least 3 hours before you go to bed. If you drink alcohol, stop at least 4 hours before sleeping. Take a gentle 15-minute walk after dinner. Not exercise, just movement. This helps initiate digestion, normalizes blood sugar, and gives your cardiovascular system a chance to settle into a stable state before you become horizontal for the night. Now let me give you the 2 positions that the research actually supports for older adults. Left side sleeping is the most well-supported sleep position for both cardiovascular and neurological health in adults over 60, and the reasons go considerably deeper than most people realize. When you sleep on your left side, gravity works in alignment with your heart's natural orientation. The inferior vena cava, which runs on the right side of your spine, is completely uncompressed. Blood returns to the heart from the lower body freely and efficiently. The heart works less to fill its chambers. Circulation stabilizes. Your blood pressure dip happens as it should. But there is a second reason for left-side sleeping that has emerged from research over the past decade, and that I think is genuinely one of the most important things older adults can understand about sleep. Your brain has a waste clearance system. Scientists call it the glymphatic system. Think of it as the brain's overnight cleaning crew. While you sleep, cerebrospinal fluid pulses through the spaces between brain cells, flushing out the metabolic waste products that accumulated during your waking hours. Among the substances cleared this way are amyloid beta and tau proteins. These are the same proteins found in excessive accumulation in the brains of people with Alzheimer's disease. A landmark study published in the Journal of Neuroscience found that this glymphatic clearance operates most efficiently when you sleep on your side, and the left side appears to offer slightly better drainage geometry based on the brain's natural asymmetry and the direction cerebrospinal fluid flows. This means left-side sleeping is not just about tonight's circulation. It is about whether your brain is adequately clearing the biological waste that over years and decades accumulates into cognitive decline. Every night you spend sleeping on the left side, your brain's cleaning crew is running at full capacity. Every night spent in a position that compromises that process is a night of incomplete clearing. If you are not currently a left-side sleeper, a full-length body pillow placed in front of you prevents rolling onto your back or stomach. A pillow between your knees keeps your spine in a neutral position and reduces hip discomfort. Most people who commit to this position for a week find their body adapts more quickly than expected. For those who genuinely cannot tolerate side sleeping due to shoulder pain, arthritis, or simply decades of established back sleeping habit, there is an effective alternative. Back sleeping with 15-degree upper body elevation. The entire upper torso elevated on a gradual incline between 15 and 30 degrees. not pillows stacked under your head. Your whole upper body raised so the angle begins at the hips, not the neck. A wedge pillow achieves this well. An adjustable bed achieves it even better. This elevation uses gravity to assist blood return from your lower body toward the heart. It reduces the intracranial pressure buildup that flat back sleeping creates. It keeps the airway more open, which improves oxygen delivery throughout the night. Adding a small pillow under your knees to support the natural lumbar curve distributes pressure evenly across the entire body and eliminates concentrated strain on any single vessel or joint. This position is particularly valuable if you experience morning headaches, frequently wake feeling unrested despite adequate hours in bed, have swollen legs or ankles, or have been told your blood pressure remains elevated even during sleep. Beyond position, there are 3 environmental factors worth addressing because they shape whether your cardiovascular system genuinely recovers during sleep or continues working harder than it should. Temperature matters more than most people realize. Keep your bedroom between 65 and 68 degrees Fahrenheit. A cooler sleeping environment supports the natural drop in core body temperature that triggers deep restorative sleep. It also naturally assists the overnight blood pressure reduction that is so protective for the heart and brain. A bedroom that is too warm keeps the heart rate slightly elevated and keeps you in lighter sleep stages where cardiovascular recovery is minimal. Light exposure in the evening is the second factor. Light from phones, tablets, and television after 9 in the evening suppresses melatonin production and delays your entry into the deeper sleep stages where the brain's glymphatic cleaning system operates most actively. If you are watching screens until you fall asleep, the most important biological work your brain does overnight is being delayed by the very habit you use to wind down. The third factor is noise. Sounds that do not wake you fully still disrupt deep sleep through brief micro-arousals you never consciously register. During each one, your heart rate briefly spikes and cortisol rises. Your vascular system responds to every single one, even though your conscious mind is unaware. A white noise machine or simple earplugs can eliminate this variable entirely, and the improvement in deep sleep quality that follows is often dramatic. One practical tool worth considering that very few older adults ever use is an overnight pulse oximeter, a small clip-on device you wear on your finger during sleep that tracks blood oxygen levels throughout the night. If your oxygen regularly drops below 92%, that is data your doctor genuinely needs to see. It could indicate sleep apnea, circulation problems, or early respiratory changes that all meaningfully increase cardiovascular and stroke risk. This is not an expensive device. It is available at any pharmacy, and the information it provides can change the conversation with your doctor in ways that years of annual checkups never did. Let me bring everything together clearly. 6 sleep mistakes that are quietly working against your brain and heart every night. Sleeping completely flat, allowing intracranial pressure to build. Stomach sleeping, creating hours of restricted vertebral artery blood flow and compressed breathing. Stacking multiple pillows, forcing the neck into flexion that obstructs both arterial flow and brain drainage. Right side sleeping with cardiovascular history, adding nightly resistance to a heart that cannot afford it. The tightly curled fetal position simultaneously compressing the lungs, the leg circulation, and the neck vessels. And late eating combined with alcohol, disrupting the protective nighttime blood pressure dip that your cardiovascular system depends on. 2 positions that actually support recovery. Left side sleeping, which optimizes heart circulation and maximizes the brain's waste clearance system, and elevated back sleeping, which uses gravity to support blood return, reduce intracranial pressure, and keep the airway open. Pick one change from today, just one. Switch to your left side tonight. Elevate your upper body 15 degrees. Stop eating within 3 hours of bed. Replace 3 stacked pillows with 1 contoured pillow. Any single one of these is not a small adjustment. It is a consistent nightly intervention that compounds its benefit every single night over weeks, months, and years. If today's video helped you, please give it a thumbs up and share it with someone you love who has been waking up with unexplained headaches or who has never thought about what their sleep position is actually doing to their brain and heart overnight. Subscribe if you are not already part of this community. Every week I bring you honest, practical health information specifically built for adults over 60. And leave a comment below. Which of these 6 mistakes do you think you have been making, and which change are you going to make first tonight? I read every comment in this community, and your answer genuinely matters. Take good care of yourself. The hours you spend asleep are some of the most important hours in your entire day for your brain and your heart. Make them count. I will see you in the next one. Just remember, this video is for educational and informational purposes only. Always talk to your doctor or healthcare provider before making any changes to your medications, supplements, diet, or health routine.